Right, so the sad thing about this is that Jack doesn't have a knee problem, which is good for you, Jack.
Yeah.
But we're going to fit a knee brace to him anyway, so.
Okay. So in this case, we were already sized up Jack, so I already knew his measurements before we started.
What would you measure?
So what we would do is we'd take a circumferential measure. So can I get you to stand up if that's okay? So just sort of looking down here, all we're doing is taking a depth there at 15 centimetres. We're taking a circumferential...
15 centimetres from the bottom of the patella?
Mid-patella, yeah.
Mid-patella.
And this then gives us a size. So in this case, is about 36, which would put him in the region of a medium brace.
Yep.
From a sizing point of view, we've just changed this recently. So the extra small to medium is one size, and then there's a large to double XL. The other thing that's very important to know is which is the affected compartment. So in this case, okay, Jack doesn't have medial compartment OA, but it's a right leg on the medial side. So we would have we have that brace, but effectively 80%, 70 to 80% tend to be medial. If it's lateral, you just order a lateral version.
Okay.
And the brace is effectively identical. It's just that the shaping is very different on the lateral sides.
Okay.
So yeah. So we've sized him up accordingly. We would then order the brace. We've recently changed all our packaging and that sort of thing, so it's all much more green and recyclable. And effectively, this is the way the brace arrives. And one of the things that we use, I talked about them being designed holistically, but we're trying to avoid D-rings and things like that without having to thread straps through and that sort of thing. So in terms of application, it just has a simple color-coded system. So we have blue here and blue here. They click that in and then fold that over. Exactly the same at the top. So what I often would say to patients is kind of ignore the fitting side of things that I'm doing initially, because effectively it's 2 clips for them, and then they're then good to go. So have a seat again, if that's okay. So I'm just going to straighten your leg, and if you just slide forward a little bit, because what we need to do is actually get this in position here. So the important thing is making sure that we've got this position correctly. Everyone always wants to fit it, all braces a little bit low. So this logo here, we're lining up with the top of the patella. The hinge here, we want at the midline here like that. And what we're actually doing is we're bringing this strap around, fastening blue on blue. And again, this stage is really what the clinician is doing. You don't really need to, the patient won't do any of these stages. And then tightening the strap, and you can trim all these if you need to. So that goes up and over the calf. And then we're then fastening the top section. So again, yellow on yellow. Now this is quite loose at the moment, bear with me. And we're just going to fasten this thigh strap here. Now we have this ability to tighten this at the front.
You've got those wonderful little boa devices, which I've got on my cycling shoes. They're fantastic.
Exactly. So those are really good for micro adjustments. And what they're there for is for the patient to adjust themselves. So say, for example, your knee was particularly comfortable doing a specific activity, you can actually increase or decrease these dependent on your pain relief needs. So can I get to stand up? And what I'm actually going to do is just set up these diagonal straps. So these are called dynamic force straps. And the dynamic bit comes in as a result of the fact that when you actually flex your knee, you don't actually necessarily need that same level of unloading. Just going to go a touch tighter on there. You don't necessarily need that same level of unloading. So you see when Jack actually bends his knee, these will actually go loose to some extent. And that's in line with where the area affected by the osteoarthritis is, because it's normally in the last sort of 10 to 15 degrees to full extension. So all I'm doing here, obviously normally I would trim these after I've initially fitted this, but we've got it in position. Have a seat again. And then I will just tighten these up. Now the ideal position is to have it in the central section. Used to be 5, and I always try and stop myself doing that. But we're tightening these up. And then if you just straighten your leg for me, you should be able to feel a little bit of force there, and we can just check the strap tension. So describing strap tension is quite tricky. The other thing that we would consider is the patient's skin condition. So in this case, really good skin condition, and we wouldn't have any concerns with having these nice and tight.
So when you said the central section should be 5, what are you referring to?
Just this here, so it's now this sort of circular window. That's the midpoint.
Yeah.
So I'm just setting this up. So just bend your knee a little bit, because at the moment I'm using these smart dosing dials just to set it up. But when the patient leaves, we would always adjust it so that their correct level of tightness is at the midline. So they can go tighter if they need to, they can slacken it off if they need to. And really reducing the tension is more to do with volume changes. If there's any swelling or whatever, they've got the capacity to adjust that.